CNA Cultural Modesty Accommodation. Welcome to the quiz. Question 1. When providing passive range of motion, PROM, exercises to a resident's shoulder, at what point should you stop the movement? Option A. When the resident says, "That's enough," even if you have only done a few repetitions. Option B. At the point of resistance or the moment the resident reports any pain or discomfort. Support the joint above and below, move slowly and smoothly, and never force a joint beyond its comfortable limit. Option C. After moving the joint through its full range 10 times, regardless of feedback, to ensure the exercise is effective. Option D. When you feel significant resistance from the joint, even if the resident is not complaining of pain. The answer is B. Stopping at resistance or pain prevents injury during PROM. Option A is incorrect. While respecting the resident's wishes is important, the primary indicator is pain or resistance. Option B is correct because forcing a joint beyond resistance or pain can cause injury. Option C is incorrect because counting reps regardless of feedback can cause harm. Option D is incorrect because resistance without pain may be normal, but you should not force. You stop at resistance. Question 2. A resident has an order for a clear liquid diet. Which of the following meal trays would be appropriate to serve them and why? Option A. A cup of broth, a small dish of applesauce, and a glass of water. Applesauce is a pureed solid, not a liquid. Option B. A cup of black coffee, a bowl of gelatin, and a can of ginger ale. These are all clear liquids that are liquid at room temperature and leave little residue. Option C. A glass of milk, a cup of tea with cream and sugar, and a bowl of ice cream. Milk and ice cream are not clear liquids. Option D. A bowl of chicken noodle soup, a grape popsicle, and a glass of apple juice. The soup has solids. The answer is B. Clear liquids are transparent and liquid at room temperature. Option A is incorrect because applesauce is a pureed solid, not a liquid. Option B is correct because black coffee, gelatin, and ginger ale are all clear liquids. Option C is incorrect because milk and ice cream are not clear liquids. Option D is incorrect because chicken noodle soup contains solids. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. You are helping a resident dress after a shower. They have left-sided weakness from a stroke. In what order should you put on their clothing and why? Option A. The order doesn't matter as long as they are dressed. Focus on their comfort and modesty. Option B. Start with the left, weaker, arm and leg, then the right. This allows you to manipulate the weaker side first while the resident can still assist with the stronger side, and it makes undressing easier later by reversing the order. Option C. Start with the right, stronger, arm and leg, then the left. This is easier for you and faster for the resident. Option D. Put both arms in the shirt at the same time to save time and minimize discomfort. The answer is B. Dressing the weaker side first is standard for hemiplegia care. Option A is incorrect because order does matter for ease and safety. Option B is correct because dressing the weaker side first allows you to maneuver the limb while the resident can still assist with the stronger side. Option C is incorrect because dressing the strong side first makes it harder to dress the weak side. Option D is incorrect because it's impractical and may cause discomfort. Question 4. A resident has a urinary tract infection, UTI, and is suddenly confused, restless, and trying to get out of bed. This is a change from their usual alert status. What is your priority action? Option A. Sit with them, try to reorient them calmly using a soothing voice, and call the nurse immediately to report the acute change in mental status, as this could be delirium caused by the infection. Option B. Apply a soft wrist restraint to prevent them from falling, as safety is the top priority. Option C. Give them a PRN sedative from the medication cart to calm them down so they will rest. Option D, tell them firmly to stay in bed and pull the side rails up to keep them contained. The answer is A. Sudden confusion, delirium, in a resident with UTI is a medical emergency. Option A is correct because sudden confusion, delirium, in an elderly resident with a UTI is a medical emergency that requires nurse assessment. Option B is incorrect because restraints require a doctor's order and are not first line. They can increase agitation. Option C is incorrect because CNAs cannot administer medications, and sedating without addressing the cause is inappropriate. Option D is incorrect because firm commands may escalate, and side rails alone do not prevent falls if they climb over. Question 5. What is the primary purpose of turning and repositioning a bedridden resident every 2 hours? Option A. To make the resident more comfortable and prevent boredom from lying in one position. Option B. To give the nursing assistant a chance to check the resident's skin for any breakdown. Option C. To prevent contractures and maintain joint mobility. Option D. To relieve prolonged pressure on bony prominences, which compresses capillaries and restricts blood flow, leading to pressure injuries, bed sores. The answer is D. Pressure relief is the primary goal of turning schedules. Option A is a benefit, but not the primary physiological reason. Option B is a benefit, but not the primary purpose. Option C is a benefit, but not the primary purpose. Option D is correct because the main goal is pressure relief to prevent pressure injuries. Question 6. When assisting a resident with a sitz bath, what is the most important observation for you to make and report? Option A. How long the resident sat in the bath to ensure they don't exceed the ordered time. Option B. The water temperature to ensure it is warm, not hot, and comfortable for the resident. Option C. Whether the resident found the bath comfortable and soothing for their perineal discomfort. Option D. The color and amount of any drainage, bleeding, or clots in the water after the bath, as this could indicate a complication from hemorrhoids or postpartum/episiotomy healing. The answer is D. Abnormal findings like bleeding require immediate reporting. Option A is important, but secondary. Option B is important for safety, but the observation of the outcome is more critical. Option C is subjective and not the most critical clinical observation. Option D is correct because abnormal findings like bleeding or discharge need immediate reporting to the nurse for assessment. Great job! Don't forget to subscribe. Bye!